These are the questions for the Remote Health Science Spring Assessment. How many abdominal regions are there? 4, 6, 9, or 11? A root word is a syllable placed at the end of a word, a syllable placed at the beginning of a word, the main word part to which prefixes and suffixes can be added, or a word describing a medical procedure. Which of the following prefixes means fast? Tack, track, Brady, or Fassy? What is the meaning of the suffix itis? Pain, inflammation, removal, or sensation? Which type of software would be used to create financial records on which math operations can be performed? A spreadsheet, word processing, a database, or an optical scanner? A person who is computer literate has years of experience working with computers, a basic understanding of computers and their applications, knowledge of how to set up and troubleshoot computers, or just enough knowledge to perform his or her job. A hospital emergency room treated 36 people in one day. If 24 of the people were children, what was the ratio of children to adults that day? 2 to 1, 1 to 5, 2 to 5, or 1 to 2? "5:50 p.m." would be what equivalent in military time? 0550, 1550, 1750, or 1350? What is the term that describes the measurement of distance between the plane and the line of an angle? Horizontal space, vertical incline, bias, or degrees? If a patient drinks 2 cups of coffee at 240 milliliters, a glass of orange juice at 240 milliliters, and adds half a cup or 120 milliliters of milk to cereal at breakfast, what is the total amount of fluid in milliliters the patient consumed? 600, 360, 500, or 720? A written prescription indicates a patient is to take 2 pills per day. The prescription is for a 30-day supply. How many pills will the pharmacist dispense? 30, 60, 90, or 120? A patient's temperature is 100 degrees Fahrenheit. What is the Celsius equivalent of this temperature reading? 35 degrees Celsius, 37 degrees Celsius, 37.8 degrees Celsius, or 40 degrees Celsius? To convert measurements from one system to another, set up a proportion and solve for the unknown quantity. True or false? The Arabic numeral 25 is written as XXVL in Roman numerals. True or false? Percentages are used to record statistics, calculate therapeutic diets, and mix solutions for infection control. True or false? Round 1,379 to the nearest thousand. 1,000, 1,379, 1,380, or 1,400. The horizontal plane that divides the body into a top half and a bottom half is the coronal plane. True or false? Body parts located below the transverse plane are superior, proximal, distal, or inferior. The stomach, small and large intestines, liver, gallbladder, pancreas, and spleen are located in which body cavity? Pelvic, thoracic, buccal, or upper abdominal? Computer-aided surgery is also known as robotic surgery, computerized tomography, radiation therapy, or image-guided surgery. A syllable or word placed at the beginning of a word is called a what? A prefix, a suffix, or an abbreviation. What is the proper way to record this blood pressure reading? Diastolic 68, systolic 96. 68 over 96 or 96 over 68? What is the normal range for pulse in an adult? 60 to 100, 60 to 80, 80 to 110, or 90 to 140? Which fact do we not note when taking and recording respiration? Rate, rhythm, character, or volume? What do the abbreviations mean in this sentence in order? A patient went to the ER and the DX was a UTI following a CT. Is it emergency room, discharge, under the inferior, computerized tomography, emergency room, diagnosis, urinary tract infection, computerized tomography, external rotation, diagnosis, urinary tract infection, computerized tomography, or external rotation, discharge, urinary tract infection, or computerized tomography? Which of the following is the correct abbreviation for diagnosis? DC, DRG, DNR, or DX? What sources must healthcare workers use when deciding which abbreviations and symbols to use on their job. Those listed in their textbooks, those approved in the facility in which they work, those listed in medical dictionaries and reference books, or those provided by their professional organization. Which computerized diagnostic tool is widely used to learn about the condition of a developing fetus? Positive emission tomography, computerized tomography, echocardiogram, or ultrasonography? Name the arterial pulse site located in the side of the neck. Radial, carotid, doralis pedis, or posterior tibial? Respirations above 25 per minute in adults is known as orthopnea, bradypnea, tachypnea, or dyspnea. An axillary temperature is taken in the groin, ear, forehead, or armpit. Body temperature is higher in the evening. True or false? I think Mrs. B has a fever is an example of what type of observation? Subjective or objective? Teamwork improves communication and continuity of care. True or false? Which of the following is an example of an objective observation? Headache, fever, or nausea? The assumption that everyone is in a particular group is the same is known as what? Bias, stereotype, or prejudice? The ability to recognize and appreciate the personal characteristics of others, which is an important quality for healthcare workers, is known as acculturation, assimilation, spirituality, or sensitivity. What type of healthcare provides for the well-being of the whole person and meets physical, social, and mental needs? Alternative healthcare, complementary healthcare, or holistic healthcare? The classification of people based on physical or biological characteristics is known as culture, ethnicity, or race. Interpret the abbreviation. O2PRN for SOB. Oxygen preventing respiration number for shortness of breath. Oxygen as needed for shortness of breath. Oxygen squared preventing respiration number for small of back. Or optimal oxygen as needed for shortness of breath.